Hi everyone, I'm Lucas. I'm the co-op student here at the SOS Physiotherapy Belmont location.
And I'm Alicia, I'm a physiotherapist here.
So today we're going to be talking about inversion ankle sprains. So this is the most common type of ankle sprain that we see at the clinic. And just generally the main mechanism is just sudden loss of balance or loss of footing, leading to the bottom of the ankle or the bottom of the foot turning inward. And this will cause the lateral ligaments of the foot to be stretched and sometimes even torn. So these ligaments include the ATFL, CFL, and the PTFL. And depending on the actual mechanism of the loss of balance or the fall, certain ligaments will be affected more than others. So today we have a few questions for Alicia here. So the first question will be, what are general differences between grades 1, 2, and 3 sprains?
So these grades refer to the severity of the sprain, and so grade 1 would be the least severe, where you're just having some mild irritation and inflammation of the ligaments there. A grade 2 would be a little bit more severe, so you're getting actually a partial tear of either one or more of these ligaments, and then a grade 3 would be a complete tear of one or more of these ligaments.
Yeah, that's a great answer. And so for the second question, how do symptoms differ between grades 1 to 3 sprains?
So with a grade 1 sprain, your ankle's still pretty stable. You're getting a little bit of swelling, some tenderness, maybe a little bit of stiffness, but still pretty functional. With a grade 2, you're losing a little bit more function. You've got maybe some bruising, some more swelling. It's feeling mildly unstable. And then with a grade 3, you get a lot of swelling and bruising, a lot of tenderness and pain, and you're getting a lot of instability and a loss of function.
Great, yeah. So to add on to that, are there any at-home remedies to help with the sprain themselves?
Yeah, definitely. So at home, icing is really helpful, especially because you're going to have a lot of inflammation in there. In terms of that, you're also going to do some elevating too. So icing and elevating at the same time so that you can kind of help everything drain out of there. Another thing you want to do is some gentle range of motion. So I often tell people try an ankle alphabet. So moving your ankle in the shape of the alphabet within a pain-free range just to help get things moving. And then after that, some bracing or some taping options are always good just to help with some compression and some stability there for you.
Yeah, perfect. And our last question is, when would they want to seek a physiotherapist or a doctor?
So you're going to want to see a doctor right away if it's very severe. If you can't put any weight on it at all, then you'll want to see your doctor, or if there's a lot of bruising and a lot of swelling, or if it was a pretty serious mechanism of injury, so you fell on it very hard at a high rate. You're going to want to see a physiotherapist probably after a week or two if the stiffness and the swelling isn't going down, or you'll want to see a physiotherapist a little bit sooner if it's not your first ankle sprain, so if you've had a bunch in the past or if you're trying to return to sport. And then if it's a pretty mild sprain, but it's lasting for a long time, then you'll also want to see a doctor.
Right, yeah. Thank you so much, Alicia.
No problem.
All right, bye everyone.
Bye.